Hello, in this video we will discuss about the bronchitis. This bronchitis is the chronic obstructive pulmonary disease we will discuss and how it's possible. So let's begin to understand. So basically you should need to understand the respiratory system. So the basically the mucus production in the respiratory tract, which that is the major possibility to create the bronchitis. So here is the person which that is contain a trachea and tracheole and the lungs, which that is the two lungs are present in each individual. So in this way here is contain a bronchial uh, tube which that's divided into the bronchiole, and this bronchial tube which that's divided into the bronchiole and alveoli. Alveoli contain a many air sac. This air sac is inside is the contain a air space which that is empty for the gases exchange. So when it filled with the fluid, it cause the bronchitis. So how it's possible? The fluid already present, but the little amount. This is known as the mucus. So this is lining thin mucus are present, which that is the normal air sac or bronchiole. So while here you can see, and this is the inflamed bronchiole, which that's contain a rigid structure of the cartilage as well as basically rigid structure of the pipe like structure and the increased mucus and inflamed the bronchial tube. So let's begin to understand the inside the major mechanism for the production of mucus. So here is the mucus producing gland which that secrete as a exocrinally. So exocrinally secrete, and in this way the due to the infection of bacteria, fungi or viral infection will lead to here is the pseudostratified columnar epithelium which that contains cilia, and this is known as the mucosal layer, and this contains basement membrane and loose connective tissue. This loose connective tissue is very sportive connective tissue and smooth muscle layer which that is used for the constriction, so the vasoconstriction of the bronchiole, and the submucosa are present, and this is the red color is showing that is the smooth muscle layer. Smooth muscle layer is basically command through a sympathetic and parasympathetic nervous system, not voluntary but involuntary. And this is the connective tissue. This connective tissue is here, and this is the cartilage in bronchi only part, not bronchiole. So here the mucus gland are present, which that is increase the number of mucus gland due to the smoking, short the cilia and gland hypertrophy. So the smoking will cause the short the cilia will unable to outtake this mucus, and the mucus will fill in the respiratory tract, will irritate, and that will cause the bronchitis. So this was the layer of the bronchiole, the pipe of bronchiole. So here is the smoking person which that is inhale the irritant chemicals will lead to hypertrophy and hyperplasia of the gland and the cell, as well as the bronchial mucinous gland in main bronchi will increase. And on the other hand, the damage of the cilia will lead to unable to outflow of the mucus, and this will lead to fatigue, shortness of breath, and the light shortness of breath, high fever or light fever, and chills and chest discomfort. So the chronic bronchitis is due to the chronic bronchiole smoking, air pollutants, air pollution, for example gases, and the dust or toxic gases or pollen grains, which that will lead to in most cases the bronchitis is caused by the same viruses that cause the common cold or flu. So basically the pollen and the viruses or bacterial infection will lead to bronchitis. So remember. So in this way, when we will fill the mucus in our bronchiole to discomfort the breathing mechanism, will lead to coughing and eject the mucus through mouth during the coughing, due to the vasoconstriction of the bronchiole, due to the sympathetic nervous system activation, remember. So the sign and symptom we will discuss if so the inflammation also increase due to the neutrophil, and the macrophage colony will develop in the air sac. So here is the sign and symptom. Air, for example, move from the bronchiole to create the sound is wheeze, and the wheeze sound and the crackles and rails. For example, rails are crackles. And the hypoxemia, the decrease of the oxygen, and hypercapnia will increase the carbon dioxide mean, and the partial pressure of carbon dioxide will increase and the partial pressure of oxygen will decrease, will lead to vasoconstriction for better exchange of the air. But the cyanosis and blue discoloration will occur, and due to the vasoconstriction, due to the sympathetic nervous system activity, the destructive autonomic nervous system type, which that will lead to basically cause the fever, and the cortisol increase will lead to many complications. So here is the block airflow. Airflow when block, the partial pressure of oxygen will decrease and carbon dioxide increase, hypoxemia, hypercapnia, and cyanosis will occur. Blue discoloration of skin known as blue bloaters. So after the vasoconstriction, this will lead to complication. The vasoconstriction is due to the increase the blood pressure in the pulmonary circulation for more absorption of the oxygen, while increase the carbon dioxide into the air sac. So the localized to one area of lungs and the large proportion of lungs, and the effectiveness here is the localized to one area of lung, and increase the pulmonary vascular resistance. When increase the pulmonary vascular resistance due to the constriction of bronchiole by production of histamine, and the constriction of the blood vessel to constriction and mast cell degranulation allergic reaction to produce histamine will bind with the blood vessel as well as the uh, air passage, air trachea, which that will lead to constriction, will lead to discomfort breathing, and the pulmonary hypertension will lead to pulmonary hypertension will be increased when the blood pressure will increase due to the histamine and other allergic reaction, and the produce the core pulmonale. This core pulmonale means the right side heart failure. So the right side heart failure will be occur due to the pulmonary circulation difficulty, due to the high blood pressure in the pulmonary circulation. So the treatment can be reduced smoking, managing associated illnesses, supplemental oxygen and medication, and the bronchodilators and antibiotics. So basically, you should need to understand that treatment is through the ventilator, the medical ventilator machine. So thanks for watching. Please make sure to subscribe, like, and share. This was the bronchitis, the chronic obstructive pulmonary disease. So thanks for watching. Bye.